But getting back to lockdown, even though I didn't really discuss it much at all, but I needed a segue to make this, to get naturally and to start talking about the story. Let's talk about something that I don't think was been talked about much during the lockdown or when it happened. Apparently, 30,000 surgeries were put off or cancelled or delayed while lockdown was happening. Now, these surgeries, there were a lot of them. There were cancer surgeries, gynecological. I don't know how you say that, but you guys can see what the word is. Brain surgeries, and she said, while apparently the most important ones were done, there were quite a few who their health were, for the ones that were put off, there were quite a few who had deteriorating health and were still in pain because they could not do the surgeries. And the reason these surgeries were put off was because they were expected, or they were trying to prepare in case they were overwhelmed with COVID-19 cases. Now, I will bring up the COVID cases. I know a lot of people are screaming at your computer, discussing about all the cases and that. Don't worry, I'll get to that, but right now we're going to focus on these surgeries right now. Now, the Cancer Society's medical director, Chris Jackson, he was talking about how they had the number of diagnoses, I don't think it's the correct term to say, but you get the idea, they might have been a bit impacted by COVID, but he also said that it had to be, what they did had to be weighted with the fact that people with cancer are susceptible to the virus. I thought everyone was susceptible to the virus. Now, I have never experienced cancer, thankfully, and my heart goes out to everyone who has either experienced cancer or have had a loved one who have experienced or died for cancer. It is a horrible disease, so I might not be the right person to talk about this, but I'm going to play you this clip of one of the cancer patients who had her surgeries cancelled or postponed or rescheduled because of lockdown.
Cancer patients accuse the government of playing with people's lives by cancelling more than 37,000 surgeries due to the COVID-19 outbreak. Jay Reynolds Carey had her double mastectomy called off 3 times last month. Here's Mitchell Alexander.
When New Zealand plunged into level 4 lockdown, it was particularly difficult for Jay Reynolds Carey.
Delta is hell, but cancer patients are already going through hell.
She's battling cancer for a second time. In 2004, Jay was diagnosed with Hodgkin's lymphoma, and now
I've now been diagnosed with breast cancer, which they believe is from the radiation.
She's had the tumour removed and has been warned if she has chemotherapy again, she could develop a 3rd type of cancer.
So I'm on a time limit. So my surgery was back in March, and I was told if I don't have the double mastectomy in 6 months, then I would have to go down the route of chemo and radiation.
Her double mastectomy was scheduled for last month, but it was cancelled 3 times because of COVID-19.
The rug was pulled from under me.
Capital and Coast DHB says surgeries will be rescheduled based on the patient's assessed level of need. It says non-deferrable and urgent surgeries continue. But Newshub can reveal Jay's is one of 37,000 surgeries cancelled across the country because of the lockdown.
If the health services were better resourced, then we would have more flexibility and things would perhaps be easier.
Clinicians will be working very carefully to prioritise people who have had surgeries that are missed, cancer and non-cancer related.
But for Jay, she can't wait for much longer.
They're playing with people's lives. And, this is my life. And that's why I'm speaking up for all of the people out there that have had their surgeries cancelled.
And Jay may not need to wait too much longer. Her surgery was just rescheduled for the end of the month.
I think everyone can agree that this is just a tragic situation. It's just one of those circumstances where you've got the cancer patients who need the surgeries, but then you've got the hospitals who are probably getting orders from the government, and they're getting orders from higher up that they can't do those kind of surgeries. So basically what I'm saying is blame the government. But this is one of those really sad situations because people need these surgeries and they're not able to get them.